First of all, I would like to ask for your permission to use this video for educational purpose on internet. Do I have your permission?
Yes, you do.
Excellent. Now, Kimmy, you are my patient. You and I have been seeing each other for more than a year actually. And I understand you had a surgery in 2010 and some of the symptoms got better, but you still have lots of pain. And in 2012, they removed the hardware. And but when you and I met about a year and a half, 2 years ago, and I have been watching you doing lots of physical therapy since then, you have been in significant pain. Would you like just explain to me what were your symptoms before we did our surgery, and in what status, how bad was the pain?
Well, she said her pain was like 9 or 10 most of the time, and she had the severe numbness in the left leg and stuff, and it just, she literally couldn't do any housework or anything.
Yeah, it was agonizing, debilitating pain, I remember.
And she first was seeing you, or she had the first fusion taken out in January, I think it was, of 2012, and the first time she seen you was about 5 months after that.
Yeah.
In 2012.
And we did almost for 2.5, 3 years, we did conservative therapy that didn't really help. But then we decided that, you know, she's not getting better, she's in agonizing pain.
Right.
We said, even though you have significant medical problem that would limit you for an open surgery, we decided to give you a chance to do all of that minimal invasive procedure. Is that correct?
That's correct.
And the surgery was when?
The surgery was the 24th of May.
And about 1.5 months ago.
Yes.
And how have you been doing since the surgery?
She's doing pretty good. She's still weak, of course, and she'd spent 3 weeks in Good Samaritan nursing home, and now she has in-home therapy.
What about pain?
And the pain, she says, from the day after the surgery, she hasn't had any pain.
So pain since the surgery is gone.
She's got a little bit of numbness in that left leg and stuff, but it's other than that, why it's...
So now, and I'm going to look at the films with you on the computer. Unfortunately, I don't have a new back, and I did not give you a new back. And I'm going to show all the things that are wrong in your back. But we decided to do a limited surgery for the areas that the films and your symptoms correspond to each other. And I'm happy that, you know, you're telling me your pain is gone and you're not on pain medication anymore. Is that correct?
That's correct.
And so far, are you happy with the result of the surgery?
I am. I hope
Excellent.
She is.
What about you, Kimi? Are you happy with the surgery?
Yes.
Excellent, excellent. Now, I'm going to swing to the films, to the computer, and we are going to look at the films. And as you see here, you have a quite significant scoliosis. I'm going back and forth, and you see that your spine is side bending. And furthermore, if you look here, you have a osteoporosis. One of the bone here is completely gone, it's vanished. But we decided that your symptoms are actually coming from these 2 discs here, and you had a previous surgery from L4 to S1, and actually L5S1 was where you had your previous surgery, and we did the surgery just above it, and the hardware are in good position. In your case, because of the scoliosis, and I'm going to go to this one, the surgery is a difficult surgery, and an open surgery, and you have significant medical problem, would have been a very risky procedure. And you see how your spine is actually side bending as well as rotating. We call it torsional scoliosis. This is a quite big surgery in an open fashion way, but we were able to do the surgery minimally invasively, and I see that the screws are all in good position, as well as we see that the interbody graft, those that separate the bone, are in a very good position. And it seems that by addressing those levels that were problematic, we achieved the goal of the surgery. And I'm very happy that, you know, that you feel so much better. Now, just let's say for the, how long before the surgery did you have pain, and how bad was the pain?
Well, she's had some pain ever since 2008, January 3rd, when she had her first laminectomy surgery, and it's been a continuous thing. And when she had the fusion surgery the first time in 2010, why that didn't seem to help.
Yeah. So how bad was the pain before the surgery? 8, 9, 10?
Pain has been varied from 8 to 10.
Okay. And that pain is completely gone since the surgery?
She tells me it's completely gone.
Okay, well, I thank you for this interview, okay?
Thank you.